Thanks for watching. We're glad that you are keeping it K24 this morning. My name is Shiko Kaitani and welcome to our social hour. This is our health and wellness segment. And as you know, we continue the conversation around coronavirus. And now with the announcement of the first case of coronavirus being announced by the Health Cabinet Secretary Mutahi Kagwe this past Friday, there has been a spike in mass panic cases around the country. And I'm sure you've even seen the evidence too that has been circulating. Absolute mayhem when it comes to supermarkets, people taking precautions. But because the big question though is what is next? It's not enough to ask the government to be prepared for a possible outbreak. Are you equally doing your part? Are you prepared? Let's give you the facts this morning. And as we talk about the precautionary measures you need to take, I'd like to welcome Dr. Philip Ngere from the Ministry of Health. Thank you so much for being with us today. He is a medical epidemiologist with us. Right at the center, representing the World Health Organization, is Dr. Rudy Eggers. Welcome to the show. And then back for a second time is Dr. Paul Yonga, infectious disease specialist, who was with us last week on the show. Thanks a lot for making time for us yet again. So this is what's up. Everybody is supposed to be having this. Gentlemen, are we prepared? Are we? Yep. Everybody has their sanitizer. Wow, look at that. You saw what has been happening. Did you see what has been happening around town? Did you see the pictures circulating? People bulking up on sanitizer, bulking up on soap and toilet paper and what have you. So there is panic out there. Your thoughts, Dr. Philip, on that? What you've been seeing?
Thank you, Shiko. Good morning, viewers. Honestly, because of the information out there, and we are reading beyond our borders, getting to know where things have become worse regarding this infection, translating it on ourselves and responding appropriately. My take on it is that the way we respond to the outbreak depends on our level of transmission. And the response is usually informed and guided by the government. Right. They will inform us in which state we are. Are we having imported transmissions? Are we having local transmissions? Are we having community transmissions? And each form of transmissions as a way of response. So I think we don't need to panic. We need to listen to what is coming from the government, what we are saying, in which state are we, and what is expected of us. And, a panic only means that in our perception, we think it's gone out of control.
Yes, but why shouldn't we panic, Daktari, considering how now we are dealing with a pandemic? So people are wondering, okay, is the Ministry of Health and the government taking this a bit too, they're being a bit lax around the situation, so to speak?
Really, there's no need to panic. Whether this outbreak is controlled or not controlled is not really based on what the government says. It's based on what we do as individuals. Okay. The government will provide a roadmap, and we expect it to follow as citizens and as the public, so that we help bring this outbreak to a control. Okay. Instead of panicking and not following what is being advised, then I think we might make things worse.
All right. Dr. Rudy, I'm going to get to you in just a second, but let me start off with Dr. Paul. As a recap, last week you actually mentioned about this strain of the coronavirus. Please just tell us a little bit about the virus itself and actually what makes it as deadly as it is. What are we dealing with right now and what makes it so infectious?
Yes, so currently what we're dealing with is what we refer to as the SARS coronavirus 2. So this is one of the coronaviruses that have actually been established as a human infection, right from spread from the bats through various animals. Right. So the current SARS coronavirus 2 is responsible for what we know as COVID19. That's the disease that it causes. Now, when you compare it to the previous two siblings, that is the SARS coronavirus 1 of 2003 and the MERS coronavirus of 2012, this one does not seem to have a higher case of mortality as compared to the previous two. The previous two are actually more lethal than this current one. Why it is causing a bit of an issue is because it's quite more aggressive, especially in the elderly, people with pre-existing conditions, patients who are on drugs that can suppress your immune system. That's where things are a bit complicated. Then also it's much more contagious than the previous two.
And just, you know, to build up on that point, Dr. Rudy, when we talk about who are the most vulnerable to contracting this particular virus, who are we speaking to who need to take extra precaution, in your opinion?
Thank you. So clearly the disease can affect everybody. So everybody may get infected. So it's not a question of who will be infected. I think everybody can be infected, including young adults and children. The problem is that the elderly, people above 50, 60, 70, 80, are the ones that get the disease more severely and are more likely to die. So really, if you talk about who are the vulnerable, it is really the elderly and the people that have pre-existing lung conditions or heart conditions that really are more severely affected by this disease, in a sense that they get the disease such that they probably need more hospital care and are more likely to succumb to the disease.
So the cases that you are seeing is someone who already has a pre-existing condition, perhaps. Can you give us examples of some of these conditions that you would like to highlight so that we keep that in mind?
So it's not only those that have precondition it's mainly the lungs that are affected. This is the clinical picture is really like a pneumonia, a lung infection. Basically, the virus causes the immune system to overreact to some extent, and that causes some fluid to build up in the lungs. So people that have got any deficiency of the lungs, be it through previous infection, be it through heavy smoking, or heart disease, those are the most likely to really have a big problem with this disease. But let's be clear, other people can also get the pneumonia, even the previously healthy. It is just more often in the elderly and the ones with preconditions.
All right, let's rope in our audience at this particular point. We do have a question of the day for you. We would like to hear your opinion. And of course, throw in any questions or concerns that you may have to our specialists. By the way, this is why they're here, to answer what you have in mind. And let's clear up the air for you. That being said, there's a question of the day that's been slapped on your screen. As a citizen, what role have you played to minimize the spread of coronavirus? Pretty much, what are you doing to just take precautionary steps towards this pandemic that we are dealing with? Because like we said, it really is also about you. It starts with you. As a citizen, what role have you played to minimize the spread of coronavirus? You can see that SMS number 21222. If you do want to talk to us through our social media platforms at K24 TV on Facebook, Instagram, and of course, Twitter. WhatsApp is also active, and we will be taking a look at some of your text messages in just a moment. So Dr. Philip, last time you were here, we were actually talking about self-isolation. Yes? Now, the question comes in, what am I doing when I'm in isolation? Right now, we can see what has happened. Schools have been closed. Gatherings have more or less been banned, for lack of a better term. You can even see what has happened down in Mombasa, Governor Joho, even closing nightclubs. You know, so here we are, we're pretty much self-isolated. But what am I doing when I'm at home?
Thank you. When you're in self-isolation or self-quarantine, it simply means you keep away from the rest of the public. And not all of us qualify for self-isolation or self-quarantine. Only those of us who are likely to have made contact with cases, or those of us who've traveled from countries that are reporting cases, are expected to be in self-quarantine. While in self-quarantine, it means you stay on your own, you are indoors, or you are in your own house, you are not making contact with the rest of the family members or the rest of the public. And should you find yourself in a situation where you need to move from where you are to where others are, then you need to use a face mask so that you minimize the risks of spreading the disease. So while in self-isolation, you just stay on your own, stay indoors. And you observe other measures that we talked about. You make sure that when you are sneezing, you use tissue papers, serviettes, and dispose of them safely.
Yeah.
You clean your hands regularly, and the environment is cleaned and sanitized.
Okay.
Yeah.
When we actually talk about being able to recover, so to speak, from this, what are you saying? There is no medication you're going to be taking while you're in self-isolation. Your body ideally should be able to fight this off?
Thank you. While in those who go to self-isolation are not people who are sick. They're not even people who are suspected to be sick. You're only suspected that you might have been infected. So you have no signs, you have no problems.
Yeah.
And while in self-isolation or self-quarantine, you're usually monitored daily. And you're monitored for development of symptoms, including temperatures going up, cough, sneezing, difficulties in breathing. And the moment you show any sign, then you are moved from self-isolation to, you move from quarantine to hospitalized isolation for management. And we are saying there's no medication as we speak, but there's symptomatic treatment. We've just been informed about pneumonia. Yeah. Pneumonia as a treatment. So if you're going to have pneumonia and you're also infected, then that pneumonia will be managed. Yeah. If you have fever, body temperature is going high, then those are managed. If you are coughing, you are sneezing, those ones have medicines that can manage them. Yeah. But the virus per se, currently has no treatment.
Okay. Dr. Paul, speaking about this virus and how it obviously does spread very easily, you know, let's talk about some of the habits and some of the things that we do on a day-to-day basis that you may not be aware of, because now this is about being more or less intentional, you know, about some of the things that you're doing. So help us understand how this virus operates.
So from the data that we have currently, and from what we know, it's pretty much a respiratory infection. And so a lot of things that people do, especially, I must say it must be pretty unhygienic how we spread people who just cough anyhowly, people who sneeze without covering their mouths, people who don't wash their hands regularly, or you don't sanitize in between activities. All those can really predispose your risk of contracting SARS coronavirus too. Right. Of course, as well, people who are really, as Dr. Rudy said, people who already have pre-existing conditions, people who have advanced age, people who have suppressed immune systems. Those people ideally should be really at the forefront of making sure that they maintain the highest of hygienic measures, including making sure that you wash your hands as regularly as possible. If you can, please have a sanitizer with you. If you can, as well, please have disposable tissue or a handkerchief that you can easily dispose of as soon as you've blown.
One of the things that people are also not sure about, and this is one of the frequently asked questions that come in, is about the manifestation of it.
So majority of people who present with COVID actually present with very high fevers. Then a few will also present with very dry cough, and a couple of them will present with muscle pains, joint pains, just a normal common cold, so to speak. And that happens in about 80 to 85% of people who get it. Then another 15%, where another 12 to 15%, the clinical course may be a bit more aggressive, where they now start presenting with difficulty in breathing. And some of them now actually ideally have to be in hospital for either intensive care, therapy, or administration of supplemental oxygen to help them breathe.
All right, Dr. Rudy, when it comes to the World Health Organization's recommendations on how we can actually implement some of these measures within the family, what would you recommend in terms of how we prepare this unit for what could be a possible outbreak right here in Kenya?
So really there are two parts of this. The one is the personal part, and we've heard about that. That's really how you deal with yourself and your family. And as we've said, the hygiene is most important. Let's emphasize that water and soap is very, very good. It's actually almost better than sanitizer. This virus is very susceptible to soap. So washing your hands with water and soap is is very good, is a very good means.
Okay.
But all the other measures that we've heard about in terms of hygiene.
Yeah.
So all of that is the personal space. The more structural community space is what the President announced yesterday, is keeping apart from each other, not going to crowded places, not being in crowded vehicles, removing yourself from school, those kind of things. So you can see that both of those are quite important. On the one hand, your personal hygiene, on the other hand, the structural measure that the government has put in place to allow people to distance themselves from each other.
Right.
The second part is really important. So we've seen in China and other places that really the way that they have controlled the disease is really by reducing the movement, by reducing people coming together.
Right.
Now, obviously, within a family, you will be together.
Right.
You will not distance yourself unless you are really self-isolating. If you're self-isolating, as you mentioned, that person should ideally be in a separate room, if possible, at least in a separate part of the room, and they should practice these hygiene measures.
Okay.
I just want to reflect back on a question you had mentioned earlier about why should we not panic?
Yeah.
Now, you should realize that even in the epicenter of this disease in Wuhan City.
Right.
Now, Wuhan City is a huge place. It's 11 million people. So even Nairobi is a little bit smaller than Wuhan City. Even in Wuhan City, there have been 50,000 cases.
Yeah.
So in an 11 million city, you have 50,000 cases.
Right.
So that's like a stadium full of people that actually ultimately got ill. But the reason that they've been able to maintain it at that level was this structural distancing, making sure people don't go to school, not taking part in big events, etc., so that you can prevent that.
Okay.
So clearly we don't need to panic, but we do need to follow the advice of government, both in the personal space and in the social distancing space.
Okay, I think this question can actually go two ways, to both Ministry of Health and the World Health Organization. How do you believe that this is going to be implemented in developing countries? You've got very highly densely populated areas. For example, if you're perhaps talking about a slum, how would someone, for example, in Kibera be able to follow some of these guidelines given, with the kind of situation or environment that they're living in? Is it really actually possible?
Well, certainly the first step is the individual's willingness to do it. So people should actually realize their actions have now got a consequence for the people around them. Yeah. So the first step is really your personal willingness. I will be part of the solution in this case. Yeah. So even in slums, even in Kibera and these places, you would follow the same advice that is being given by government to the extent possible. We know that there's no running water, but you can set up a place where you can wash your hands. You can have sanitizers if they are available. Yeah. So the first thing is an attitude change by individuals. I will be part of the solution. I will not go running around and spreading the disease, but I will follow the advice that has been given.
Okay. Dr. Philip, maybe you can tell us MOH's plan to deal with such, key populations around the country.
I totally agree because of our various socio-economic stratifications.
Yeah.
One solution cannot apply
to all,
equally across board.
Yes.
So those challenges are things that I think have been taken to note. We've taken note of. We are saying that let's do what you are referring to as social distancing. Let's keep apart and let's keep indoors when you suspect, when you're a contact or you've traveled from an area that is reporting cases. But in the event that the same has to be applied in slum settings, probably consider modifications. Yeah. If you find yourself in a situation where you are not able to keep your distance, like for me working in a hospital, then I have to don a mask. So if I'm going to see a patient, because I'm not able to keep a meter from that patient, then I have to don a mask to protect myself.
Have you received these concerns that someone will say, okay, our financial capability as a people. Can your average Kenyan be able, number one, to afford the masks, the soap, the water? Is government going to be able to set up those stations, perhaps in some of these areas then, to at least help the people? I don't know. It's just me asking on the top of my head.
The challenges are there. We are not running away from the fact that the challenges are there.
Yeah.
But then we'll continue working with collaborating partners to find out solutions to these challenges. One of the ways that we fell short of mentioning is that, you know, water and soap is the most preferred, is the most recommended in terms of hygiene. But in situations where this is not very practical, then you advise that you have your hand sanitizer. In slums, where probably there could be no running water and modifications for running water cannot be done, because when you talk about running water, you're not just referring to piped water. You can have jerry cans with the taps and you know, create modifications to have running water. When this cannot happen, then probably the next best option is to find a way of supplying the residents with some form of hand sanitizer.
Okay. All right. So we actually want to hear from you this morning. In fact, I'm going to ask my director to even open up those lines in case there are any calls that want to come in. And speaking about text messages, if we do have a few, why don't you let me know, Bona Director, so that at least we can start to answer some of the questions concerning the coronavirus. I do want to engage you now, Dr. Paul, on this next question. And, you know, when we talk about explaining this and preparing your family to understand how to deal with the coronavirus, maybe you may know how to, but does your child understand what is currently going on? So what's the most appropriate way to actually explain the coronavirus to your child? And so let me engage you here, Dr. Paul. When you actually try to explain what a virus is to a child, how am I going to do that? I know there's an amazing presentation that was done by mindhearts.kids on the same. I don't know if we'll be able to put that up on the screen, but how would you explain this to your child, by the way? Assuming you've got a 10-year-old, a 9-year-old, what's a virus, you know?
Oh, that's an interesting question.
Yeah.
So probably, first of all, depends, of course, on the age of the child. Of course, if we're talking about a 10-year-old child, this is someone who probably is at the age of probably understanding what germs, because that's what they call it in science. They call them germs. Yeah. So I'll probably describe it as a germ that comes in when you do not take care of yourself in terms of hygiene. If you're playing maybe marbles or you're playing football and then you forget to wash your hands, you will get germs. And so you want to make sure that you do not want to put your hands all the time on your mouth. Right. You do not want to touch your face all the time, because the germ will go in. Yeah. And then when the germ goes in, the soldiers of the body will try and fight the germs, and then you'll start getting a bit sick. Yeah. So you want to try as much as possible not to get sick. It's going to be very complicated, that's for sure. Because I think the last time I dealt with kids was probably 8 years ago. Okay.
All right. So keep thinking about that, because I do understand we've got a caller on the line. Joshua, hopefully still with us. Good morning, Joshua.
Good morning.
Morning.
Yeah, very briefly in 1 minute.
Yeah.
I have a question for Dr. Rudy.
Okay.
Now, once you've had the virus and then you've recovered, does that mean that your body builds immunity such that you cannot get reinfected? That's number one. Number two, I would want to ask the government to consider this business of Mira, because if you look at the logistics on how Mira business is conducted, I think it's a risky venture in itself. And then number three, very briefly, is I want to explain to Dr. Rudy why people are panicking. You see, realize majority of Kenyans are poor people, and when even the basics that have been talked about, like water and soap, are luxury to some people, and then you are told that if you can, you work from home. Yet most of the populations in Africa fend for themselves like animals. They just live for the day. You work for today, then whatever you get is what you eat. I think people have genuine reasons to get concerned. I think that's what I had for today, Shiko.
Okay, thank you so much for that, Joshua. Dr. Paul, we've not yet forgotten about you on explaining about those germs to our totos. But listen to this, Dr. Rudy. Do you build immunity once you've already had the virus? And so that is Joshua's question, because there are also those who believe that, okay, yeah, I am not part of those who are, you know, highly vulnerable to this particular infection. So what do you have to say about that?
Well, the first thing is, of course, this is a completely new virus.
Yeah.
So everybody in the world does not have immunity against it. In fact, when we started, there was nobody that actually had any immunity. So let's be clear about that. Europeans, Africans, Asians, everybody was not immune against this disease, completely new. When you do get the disease, the body, of course, reacts and builds up some immunity. And we've seen that in China as well. It has not been long enough for us really to test how good this immunity is.
Yeah.
Is it possible to reinfect? We believe it is not possible to reinfect, but we haven't had enough science behind that. So that's still working on it. It seems that people that recover from this disease actually recover for good.
Okay.
But we need further science on that.
Okay. Dr. Philip, because now you are the government representative here with us on set, a good point that Joshua has actually brought up, considering how you talk about mtu wa mjengo, people who work from day to day. This is how they make their money and, you know, get their bread. So working from home, how does that work for your average Kenyan?
Thank you. I think I repeat, this is a general advice. And we need to link this general advice to settings that promote transmission. Settings that have gatherings. Jobs that are done indoors, in closed spaces, where you meet as an office and have your meetings and have riskier settings compared to somebody working in the open. If I'm a sweeper sweeping the street, working in the open where the air is blowing and there's sunlight, it's not as risky as somebody who is working in the office and meeting colleagues and having boardroom meetings. That might be a bit riskier. This is a general advice. It was not a directive as yet. It was a general advice that if you're doing work that can be done at home, it is advisable that please do it at home. Because
we've not gotten to the status of lockdown.
It wasn't a directive. It was an advice that so that we minimize the likelihood of transmission happening. If you are doing work that can be carried out from home, you can make arrangements to have this work done from home.
Right.
But if you have to go to work because of the nature of the work that you are doing, you've not been stopped from going to work.
Okay.
Yeah.
Okay. All right. Let's take a look at text messages coming through WhatsApp very quickly and see what you have to say. I did not go to work today. That's a very key role played here. Social distancing. Thank you so much. You didn't leave your name and your number. Good morning, Shiko and panelists. This is what I'm doing to avoid COVID-19. I also walk around with sanitizer and Dettol. Let me see that picture. Scroll down, scroll down. Okay, so you can see an individual with a mask. Okay, Asante Sana, and thank you so much for playing your part. Around here, we do a lot of hand washing. I have a good question for the doctor. Can it be transmitted via body discharge like urine, for instance, public urinals? Alex from Chuka University. Dr. Yonga, would you like to take that?
Yeah, so at the moment, we've not had any case reports about transmission via any other body fluids, apart from possible transmission through respiratory droplets that are spread via through airborne spread. But in terms of body fluids and you know, in medicine, we say never say never.
Yeah.
It's something that could be happening, but so far we've not had any evidence that suggests transmission via those body fluid routes.
Okay.
Yeah.
All right, so gentlemen, I want us to take a short commercial break, and then when we get back, we're still going to be talking about how to explain germs to your toto, including how to wash your hands properly. There could be something or two that you'd be learning in the next half hour right here on the show. That's why you need to stick with us as we talk about how to take those precautionary steps to dealing with the coronavirus, right down to the household level. Still in studio with me is Dr. Rudy Eggers from the World Health Organization, Dr. Philip Ngere, who is from the Ministry of Health, and of course, Dr. Paul Yonga, infectious disease specialist with us. Keep it K24 this morning. There's more to come.